All right, I am here with Dr. Alexandra Sowa. Welcome to the show. So happy to have you.
Thank you for having me. Thrilled to be here.
Yeah, I am so glad that we connected because you are doing such amazing things in the world. And I can't wait to talk about the product and the company that you have launched. And before we get into that, what kind of led you to this world of obesity and metabolic health in your journey as a doctor? Can you walk us through that?
Yeah, so I think I've always had a distinct interest in preventive health without ever realizing what it was. It goes way back. I actually was like a 16-year-old student, and I went to this like scholar high school summit, and Dr. Pamela Peak was speaking, and she's very active in this community. And she was so thrilling to me. She was talking about how you could prevent disease. And my dad's a doctor, and I come from this world, and I thought, I've never heard of anyone talking about this. This is so cool. Like, okay, like, yeah, we focus on all of the end stage diseases. And so even as a 16-year-old, I was like, this is so exciting, but I didn't know what I would do with it.
Yeah.
And then, I went to college, and I studied actually all of the things. I wasn't even just like a singular pre-med, and I always liked thinking outside the box. And I got my master's degree in theater, if you can believe it. That's like a secret thing that no one knows. Now your podcast listeners know. Because I always liked being really creative, and I think that's actually stuck with me as I've transitioned from more of a traditional medical space. But ultimately, I decided I really liked interacting with patients and people and helping them. And so I went to Johns Hopkins undergrad, and then I went to NYU for medical school. And I wanted to kind of treat all the things. So I went into internal medicine, and I stayed at NYU for my training. But I got pretty disillusioned really fast in my residency because so much of what we were learning to manage was disease treatment. And especially in internal medicine, you end up kind of managing the whole person, of everything from hypertension to type 2 diabetes, joint problems, aging, like memory loss. You would see all of it. And we would just be kind of learning about drugs to manage things and how to treat the disease once it arrived. And I had a really hard time with that. I really did, because it felt wrong, but I didn't know what to do about it. And especially food and nutrition and weight management, because you would learn the root cause of so many of these diseases was excess weight. And then I would see patients in clinic, and all we learned was eat less, exercise more. And you're like, how are you telling this to someone who doesn't have any more time in their space or money to go to a gym? Like, that doesn't really seem like it's going to work. And then nutrition counseling wise, here's a handout or like a government website. And I also knew enough at that point where I was like, I don't think this is going to translate. And you would just feel badly because you'd see them again in 6 months and nothing had changed except their diseases had gotten worse, and maybe you had to add on another medication. So I started searching for ways that I could help the root cause. And I was so lucky to have found, when I was in residency, this emerging field of obesity and metabolic health medicine. And I was just incredibly fortunate to have some great mentors in the space: Lou Aroney at Cornell, Eric Westman at Duke, who started. Yes.
Oh, okay. I know him. Yeah.
So they're so generous with their brains, and really try to bring more doctors and practitioners into the fold. And so in about my second year of training, once I found the field, I was like, I'm not doing anything else. Like, forget about it. I'm graduating residency and I'm pursuing this. And so after residency, I sought out additional training and became board certified in the field of obesity and metabolic health medicine, and really became obsessed. I started to incorporate it into my traditional primary care outpatient medicine practice. But what I was finding was that the traditional medical space really only allows time and room for medication management. And there's no time for lifestyle and nutrition management. And so then I became disillusioned again. So that, oh gosh, this isn't what I want to do. I always tell people that as a doctor, I have lots of tools in my toolbox, and one of them is medications. And I do speak highly of them when they're the right fit, but they have to be combined with lifestyle. So again, I found myself being like, let me tell you about a medication. And then here's like maybe a printout of what I think you should do, but I don't have time to see you back until 6 months from now. Good luck. And you'd be like, this is devastating. And then what was worse than that, and stop me at any point because the story is long, but
no, I love it.
what I found was that I would try to bring in traditional resources to help me augment what I had been learning about really like how to personalize nutrition plans. And especially when I would match things up with labs, going lower carb, doing things like fasting. Even 10 years ago, I would say, look, we don't, my boss won't even let me see you again. Your insurance company won't let me see you for 3 months or 6 months again. So I'm going to refer you out to a nutritionist. And then I would be like, it would be so devastating, because then they'd go to a nutritionist and get sometimes very outdated advice, because that was traditionally what was taught, right? So for my type 2 diabetics, they would get these crazy carb recommendations, and they'd come back only having gained more weight with their hemoglobin A1C getting worse. And I was like, what am I going to do? So I started my own practice and I built it exactly how I knew that care should be delivered, which was, you need a lot of touch points, and you need to make nutrition and lifestyle at the core of any program, even if it's medically guided, and even if you're including medications. And you need to know how to prescribe the right sort of diet. And it's not even a diet for weight loss, but just a way of eating. You need to know how to you need to have space for it, and you need to have accountability, and you need to have coaching around it. And so that's why I love connecting people like you who've also kind of figured this out. And this is how you deliver care, right? It's just high touch and high quality, and really behavior change is at the core, but not just like, I'm going to tell you what to do, but I'm going to show you how to do it and support you throughout the process. So that's what I ended up doing. And that is really what has led me now to having launched a direct to consumer metabolic health lab testing company. So people can test their own labs at home, and specifically fasting insulin, which I found in my private practice to be the #1 marker of how to kind of create these personalized plans that actually worked for people, and how to really uncover and get to the root cause of disease. So there's my story, my whole life. What else do you want to know?
I love it. So in traditional medicine, and unfortunately, I feel like I'm not a doctor, I'm just a nutritional therapist, and I see my clients who have been to so many doctors, and they have either been gaslighted, where it's like, oh no, that, your blood sugar is 99. You can't be having blood sugar symptoms right now. You can't be hypoglycemic because your blood sugar is 99. So you must be anxious. So we're going to give you a psych referral. You need to take anxiety medications. Even just the experience of my doctor, I said, I can't lose weight no matter what I do. I think I have PCOS. And his response to me was, you have PCOS, you have to lose weight, you have to take the pill, and there's no cure. These doctors are giving so many doctors a bad rap, but also it's just, to me, it's not bad people, it's bad training. So just like you were saying, in medical school, it's like this managing of disease. And that's what people are so used to. It's like, I go to the doctor to get a medication. And so they think that when they have a lifestyle condition, like I had PCOS, or someone who has an autoimmune disease, or someone who has, prediabetes, they're going to their doctor because that's who they associate with health. But these doctors are their only tool, most doctors' only tool in their toolbox, which I say all the time, that's funny that you use the same metaphor, is that they have their only tool is a prescription pad. And is that accurate? What are you taught about nutrition and lifestyle besides the eat less, move more?
So it's changing,
Okay.
but slowly.
Yeah.
I would say that the problem is the whole system,
Oh,
right?
yeah.
And so, yes, it's what we're taught, but then it's also what we're allowed to do in 98% of practices, right? Where you have these 15-minute slots, and insurance doesn't reimburse for any metabolic health management, obesity management, especially when it's coming from preventive space. Forget about it. If you code that your blood sugar is 99, well, then insurance is like, I don't care about that. It's so messed up. And so
it's maybe driven a lot by insurance and reimbursement.
Wow,
that is so interesting.
Oh, of course.
Wow.
And a lot of doctors really want to know more about this and to provide more. And there is a movement now. A lot of doctors are leaving out of network, right? But that's not why any of us went into the field, because we want to be able to provide care to everyone. But it's just not valued in this current system. And so a lot of doctors will leave and go to a direct primary care model where they have more time to do this and kind of out of pocket, and say, let's look at this as something different than your traditional doctor's experience, and let's place a value on it. But that's unfortunately, and I'm not really sure with this happened, because 100 years ago, medicine was a lot about prevention, because we didn't have all of the tools to treat disease. And so you really had to work harder on it. And then with disease development, and everyone, I will, yes, while there are a lot of doctors who will write off symptoms and will say you just need to go on the pill specifically for PCOS, which is just ridiculous. We can talk more about that. But it's not driven by, everyone's like, oh, it's driven by the drug makers. And maybe it is, but we don't benefit from it. There's like a lot of misconception about doctors like get some sort of kickback from writing meds. I have never once gotten anything, not even a pen, right? Like that's not the motivator, but it is what we're taught. And it's something that we can do that is reimbursable for insurance purposes in the visit. And so it's like you're doing something, but it's so broken. So know that doctors want to do more. But most of us, I had to seek it out, like really outside of the traditional operating system, the traditional residency. And I just saw it and saw it and saw it. And now with the explosion of social media and all these resources, it is a little bit easier to learn, I think, when you have a thirst for it. But it's definitely not being taught in the traditional system. And I think I even had a bias looking back now. I prescribe low carb, ketogenic, intermittent fasting for my appropriate patients all the time. I was scared of it. I was taught that it was so dangerous. It would give you a heart attack, that you 100% should go vegan if you had elevated, apolipo-B and like the, advanced cholesterol panels. Vegan was the only way. Weight loss 100% had to do with calories, and it sticks with you too. And so if you're not seeking out these new models of information, that's just what you retained, from medical school 20 years ago. And that's what you practice because there's no other time,
Right.
So it's a really unfortunate system.
Yeah. And I thank you for sharing that, because I feel like I have a lot of anger directed at the system, but I don't know which parts of it. So that whole concept of like billing for insurance, like as a nutritional therapy practitioner, I don't diagnose or treat disease. And I have so much success with my clients because we don't need to treat disease. We don't need to talk about disease. We focus on the foundations of health. We look at digestion and nutrient density of foods and getting out inflammatory foods and blood sugar, of course, and making sure we're getting the right nutrients and getting outside and movement. And that's what a human being needs to be healthy. So we just do that. And then we see things reversing and obviously preventing things from happening. So it's such a cool, I'm so happy to hear that there are some people starting to talk about this. And I think the system has to completely break before it changes. And I think that things are so driven by these insurance reimbursements. I was just signing up for insurance today. I'm like, what a mess. It's
the worst.
Yeah.
It is the worst. And that's really now why I have kind of launched this company where it's like, I want to try to democratize what people know. Right. So I created this kit, and I think we're going to talk about it.
Yeah. Let's talk about it.
Yeah. So I created this at-home testing kit. Oh, thanks for sharing it. Yeah, so we have 2 kits, the weight biology kit and the PCOS biology kit. And everything is, this at-home lab testing system is set up to look into your metabolic health. And it's a finger prick test, and you can do it at home, and you can order it without your doctor's oversight, get sent to you, and then you can get your results. And I want people to be able to democratize what we're starting to understand, you know, it really is at the root of prevention. But what I was finding in my private practice is that people would come to me with all these symptoms, and they'd bring me their labs from their doctor, and they would say, oh, but my doctor says it's in my head, like, or it's something,
my labs are
healthy.
Fine. Yeah.
My labs are fine. I would look at the same set of labs and I'd be like, no, I mean, you have metabolic syndrome, you have an underactive thyroid, you're vitamin deficient. And they would never, ever include insulin in it because doctors are not taught how to interpret it. They really, when I look back, I don't think it ever came up once in my training was fasting insulin. And so I would always add that one on. And then in 90% of the patients I saw, I was finding insulin resistance. And that just kind of explained all of their symptoms. And you would tell them that, and they'd be like, oh, thank goodness it's not just me. I'm not imagining it. You know, it was so validating. And then you could transform their lives through all of the things that you know, we know to be true, and all of the nutritional coaching and the lifestyle coaching. And it was just so transformative that I was like, I gotta make a way for people to be able to do this at home if they want to test it. Because, you know, even if I told my patients to go back to their doctor and order fasting insulin, they'd be like, no way. I don't know how to interpret that. There's no value in it. You know, whoever you're seeing is crazy, which is just, you know, it's just not the truth. And even if they got it, they wouldn't know how to interpret it. They would just read it by what the lab says, you know. And I'm always saying, like, the lab interpretation of fasting insulin is like 30, but the normal is 5. So, you know, that's not going to get you very far either. So we created a kit where people can order it, and they get specialized interpretation like we would give in our private practice. And really you could just have the ability to order it when they want. So if you want to get your labs every 3 months, your doctor says they only need to see you once a year, then you can order it. And it's just, I just think it's so exciting.
It is. It really is. So before we really dive into what the kit is measuring, let's talk a little bit about insulin and insulin resistance. So why is a fasting insulin so important? And so many people will say, oh, I do have a fasting insulin test. They do test it. And then they'll show me their fasting blood sugar or their fasting blood glucose. And that's not the same thing. So fasting blood glucose, we can test with that finger prick meter at home. And I think that so much of the reason why diabetes is such an epidemic is because we're looking at it from such a blood sugar standpoint without looking at the insulin resistance piece. So tell us a little bit more about insulin resistance and how, like, it's connected to all these like chronic issues that you were talking about.
Yes. So, I mean, everything you just said is true. So insulin resistance, I have found over the course of my career, is really at the root cause of the majority of chronic disease that we experience. And I first thought, going back to my origin story, I first thought that excess weight was at the core of chronic disease. But you have to go back further. And what I've realized is that even excess weight is a symptom of elevated insulin in the majority of cases. And so, okay, what does this mean? Everyone's like, okay, you're talking about this a lot, but explain it. So insulin is a hormone that's released by the pancreas in response to a sugar load. So you eat a carbohydrate, and then your pancreas is supposed to release insulin. Now, everyone always thinks about insulin and like type 1 diabetics will need insulin. Maybe sometimes type 2 diabetics will eventually need a medication. We're not talking about the medication insulin. We're talking about the natural hormone your body secretes. And it's a good thing. We need it. We really do need it. And without it, it's problematic. And we do need to give ourselves supplementation. But what happens is that over time with the traditional Western diet and the majority of Americans, you will develop something called insulin resistance because your body stops listening to the signal of insulin. What insulin's job is to be released in response to carbohydrate. It grabs it and then shuttles it off to the brain, your muscles, and all of your organs. But over time, as your blood sugars rise, because you're eating more and more carbohydrates, you need more and more insulin. And then your body says, I'm still not listening to you. So kind of give me a little bit more insulin to grab this glucose and to shuttle it over. And that's what insulin resistance is. So over time, you develop incredibly high levels of insulin. And in that process, your pancreas starts to get tired. And over time, if it gets totally tired and burned out, you will develop insulin dependent type 2 diabetes, because your body's like, oh, I'm done. I'm not making any more. I made so much for so long. You need to give me excess. But for most people before that, the high levels of insulin become very problematic. So they create unstable blood sugars. So a lot of the fatigue or hypoglycemia people will feel after they eat a carbohydrate meal will be because their insulin got so high and overshot and made the glucose go too low. And that's actually something, I think you even referred to it. Most doctors like don't understand that. They're like, that cannot be, it's not a disease. We don't get it. And you'll really be told that it's in your head, but it's very, 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 very true. And it will give you brain fog. And it will also lead to incredible and rapid weight gain. Even if you calorie restrict until, as my grandmother would say, until the cows come home, you will still gain weight, because insulin is a fat storage hormone and insulin is a hunger hormone. And it becomes nearly impossible, unless you get insulin under control, to control the symptom or the disease of obesity. And then we kind of all assume this, but the next steps would also be pre-diabetes development and type 2 diabetes development. And very much even down the road, we see increased rates of cancer, Alzheimer, hypertension, cardiovascular disease is associated even just with a high insulin state. So that's why insulin is so, so important. Where we've gotten it wrong in traditional medicine is that we didn't used to have an ability to test insulin, and we didn't really know how to interpret it. And that's what most doctors still believe to be true. And instead, what we had the ability to do was test our blood sugar with a finger prick test or in a lab, and something called the hemoglobin A1C. But the problem is by the time that your finger stick is high with glucose or your hemoglobin A1C is high, you have been insulin resistant for upwards of 20 years. Ooh. And so how powerful is that? Like, talk about the ability to prevent. If you can pick up the fact your body is like inching up in its insulin secretion years and years and years before, you will never have to worry about your blood sugar. You will never have to worry about the progression, because you can target it early. So that is the kind of the biology behind insulin, and also the biology behind why we should care, because it is incredibly powerful at preventing disease. So I love it. It's my favorite hormone. I'm obsessed.
Me too. You're speaking to the right person. I explain insulin just like you do. It's nice to hear, a doctor describe it. I'm like, okay, cool. That's exactly how I describe it too. Just always wanting to double check myself, because I didn't go to medical school, but this is what I talk about on my podcast, that insulin is necessary if we don't have it. Like, if our pancreas doesn't make it, that means we're type 1 diabetic, and type 1 diabetics need insulin to live, or else we can't put on weight. It's a growth hormone, so we can't grow anything. And so that's where the people can, like, they thought in the past that they were like peeing out their insides almost. That's why the excess sugar was leaving through their urine. So that's where the name of it actually even comes from. But with type 2 diabetes, I feel that it's so focused on the blood sugar because it's way easier to measure and we know more about blood sugar. And so oftentimes doctors are very focused on getting down the blood sugar by any means necessary, because that it's like, oh, we need to keep getting down the blood sugar. And oftentimes they give these insulin increasing drugs in a state of like prediabetes or early stage diabetes. And in my untrained, humble opinion, this is worsening the disease process, right?
Yes.
Okay.
100%. You are
okay.
You're 100% correct. Yeah. Sometimes we need it.
Yeah.
And, if you need it and it's truly needed, well, type 1 diabetics absolutely need it to live. It's life-saving.
Yep.
In type 2 diabetic management, I do find that it's often overprescribed. Less and less so now, which is exciting. We can talk a little bit more about what we're doing in medicine, even on the like traditional front. It's less and less prescribed now. But yes, if you just slap insulin on someone who has high blood sugars, well, you'll get the blood sugars down, but you're going to worsen every other disease process, because the same thing that we talked about natively when your body makes insulin and it's too high and all the problems that come with it, the same thing will happen and it'll be compounded if you're giving insulin as a drug. And we need to understand that there are therapeutic nutritional ways in 95% of type 2 diabetes management where it can be reversed on its own without insulin. But to that point, there are a lot of better drugs now that can help in the management of type 2 diabetes, and also will concurrently treat the disease, this is like a fancy word, but the comorbid disease of obesity. So there are a lot of medications that will bring down blood sugars and treat the process, the metabolic process of why your blood sugars are high, kind of treat the pancreas, give it a break, and also help with weight loss. And fat is incredibly metabolically active. So if you can lose a part of it, you will help the process of healing of the pancreas and improve the overall and reverse, hopefully, type 2 diabetes too. So I am seeing a trend where there's less and less insulin prescribed, which is awesome. I don't know if I'm yet seeing the trend yet of nutritional therapy for it. So thank you for your mission to get that across too, because it's the most powerful tool we have.
Yeah, absolutely. So, okay, now we know why insulin is so important. You talked about I'm sure you're familiar with Dr. Ben Bickman's book, Why We Get Sick. And insulin resistance is really at the heart of every chronic disease. It was driving my PCOS. I could not make a dent in my PCOS symptoms. I couldn't get rid of it no matter what I did. They did prescribe me metformin for it. And it's like, hello, blood sugar drug. Like, it didn't even cue me in to the fact that blood sugar and insulin were kind of at the root of it. But when I found out that it was, and I started addressing my insulin resistance via addressing blood sugar stuff as well, I reversed my PCOS. It was like effortless for me because I was treating the root causes. I never got an insulin test or a fasting insulin test at that time, which I'm really disappointed about because I don't know what it was. I do know my blood sugar was 60 and I was hypoglycemic. So it's giving a little cue into the fact that I was definitely, somewhere on that insulin resistance spectrum.
And I bet a doctor saw that and was like, oh my gosh, you're incredibly healthy. It's so great. I never see it that low. Like, that should always be
totally. Totally. I was shaking. I remember I was on Miami Beach and I was getting back into my car and I stepped backwards because I almost passed out. And I was like, oh, I hate fasting for blood work. Like this is terrible. I hate how I feel. I get so dizzy. And I was smelling this Dunkin' Donuts that was next door. And I'm not I didn't eat that at that time or anything, but I was just so tempted to go in there because I felt so bad. And I had never felt that bad because typically I was a person who would snack and graze all the time to prevent myself from feeling like that. Yeah. But that extended fasting, I couldn't tolerate it. And so no one said boo to me about my blood sugar, which was 60 or 63, the 3 times that I got lab work in 2016 it was.
Wow.
No one said a thing. All 3 different doctors, no one said anything. And I was like, geez, that's so bad. And like you said, it's they were maybe thinking to themselves, oh, it's under 100. So that's great. And, it's not 40 where obviously I'd be in trouble.
Right. To that point, if anyone's listening and they're like, oh, but if metformin is a blood sugar drug, then shouldn't you get off of it? And I would love to clarify there. And I'm glad, I don't know if your doctor's kept you on metformin for PCOS. So I bet a lot of your listeners know this, but PCOS is inherently a disease, polycystic ovary syndrome. It affects between 10 and 20% of all women. It's so common. It's underdiagnosed, but likely it's about 20% of the population. It is a disease of insulin resistance. And we see marked insulin resistance in at least 70%, more likely 85% of women with the diagnosis. And the excess insulin really is a hormonal disruptive driver, and vice versa. The whole mechanism of how we create female hormones is disrupted in women with PCOS that also increases insulin. So it's like a chicken and an egg, and you need to quiet the insulin in order to get your hormone levels calmed. Traditionally, there's been like so many things related to women in this world. There's just been a lot of misconceptions around this disease, and
bad advice.
people would think, well, the number one complaint would be like irregular periods. Why are your periods irregular? It's because your hormones are irregular and your body's not ovulating naturally in most cases of women with PCOS. And so the solution to that is to put women on birth control pills. So technically you're getting regular bleeding in your cycles, but you're not doing anything to fix any of the abnormal hormones. You're really just masking it. But what we did realize along the way that yes, there's some element of blood sugar dysfunction. So metformin was trialed and understood to kind of fix some of this. Metformin is a drug that increases your own body's insulin sensitivity. So you just are more effective at using the insulin it already secretes. So people think of it as a blood sugar drug, but it's really an insulin drug. It's an insulin resistance drug. And I really like it. And I have endocrinology friends, like, we should put it in the water because it's been shown, because it does affect insulin resistance positively. It's been shown to decrease rates of all sorts of diseases, everything from cancer, dementia, cardiovascular disease, and then the more traditional space like diabetes management. But people have a misconception about it. They'll think if I'm on metformin, my blood sugars will go low. But it's not a blood sugar lowering medication. It's an insulin sensitizing medication. So I just think that's a good learning point, because people they'll be like, oh, my doctor put me on it, but my blood sugars are low. But that's okay, because actually your blood sugars might go up if they're low like yours were in the setting of really bad insulin resistance, because the insulin levels will kind of come down. And then a lot of your symptoms will improve with it too.
Yeah,
so,
that's great. And I have heard, and metformin, out of all, like, I don't know a ton of prescription drugs, but I do know that it does have like longevity benefits. There's actually been, I believe there were studies that showed it had some sort of positive modulation in the gut, and that some people are considering it like that longevity drug, and then it does have these positive beneficial effects. And luckily I didn't get any side effects with it. So it definitely helped me. And then I just got off of it when my weight got to a place where I was happy with. And I was like, I just don't want to be using a drug to get me there. And I look at pharmaceutical drugs as kind of like a bridge. It's like, we're going to help you get over the hump while you work on diet and lifestyle, or just to get you there because you just can't do it on your own. And because, you've lived a life that, we've all lived a life of eating, not so nourishing food and being stressed. So sometimes our bodies can't get there. And so there's nothing wrong with medication if it's used as, this tool, like you said, and not the only solution that we have. So yeah, that's great.
Right. It can't be used as the only, because it won't work, really. I mean, it might temporarily work, but then what I've always found is that you end up just not even rebounding, but everything will progress because you haven't learned. So you have to pair the metformin with lower carbohydrate awareness if you have insulin resistance. I often will tell my patients that we do use medications. I'll say you have to fight fire with fire, because a lot of the times, a lot of the symptoms and the way that your body is right now came on with other medications or with like chronic lifestyle disturbances, or you're already metabolically dysfunctional in how your body is kind of processing food and calories and macronutrients and how it's just responding. And so it can be very, very helpful as that bridge. And I will say that I will even believe for longer term use if it's really reversed so much of the disease. So if you can replace one medication that's in the metabolic health space and take away all your blood pressure meds, all of your traditional diabetes meds, all of your aches and pain meds, your Ambien, you got rid of your CPAP, like, okay, we can handle with that balance, And so for some of my patients, they will decide with me in conjunction, okay, I figured it out, but this is helping me maintain, and it can be really beneficial.
That's awesome. And that's where that beautiful meshing of like East meets West, or old versus new, or prevention meets, modern treatment. We want to have the best of both worlds because we live in this modern society. So I love the idea that you have created this kit so we can test at home, right? And also we can test our fasting insulin, which is so, so important. Yeah. So coming back to the insulin conversation, why do we need to do fasting? And then tell us like what this marker can start telling us about our levels of health.
Yeah, so I always like for people to know, just like your story. I mean, your story is perfect. Before anyone changes, makes a big lifestyle change, I like for them to know where they started. Mm-hmm. And so you can track your progress. You can really give yourself a pat on the back, and it really confirms that this new way of eating, whether it's lower carb, intermittent fasting, whatever you're doing is working. And if you try, just do something and it's not working, you need to pivot and try something else, right? And so it's nice to know where you start. And I don't know about you, but it can take months for even me as a doctor to get into my own doctor's office if I want to, be a good patient and like not order my own labs. And even when you get there, they're like, no, you're good. You got your physical last year, nothing's changed. And so created this at-home test kit. Our weight biology kit has 8 biomarkers. Our PCOS kit, I think it has 9 biomarkers. I have to double check. I need to count it. But our weight biology kit will test for kind of like the whole metabolic health picture, including fasting insulin. And so does our PCOS kit. Our PCOS kit is helping women to either, if they have a diagnosis of PCOS, really understand the insulin resistance and metabolic health implications of it and how they can track it. But also it helps them get lead diagnosis to women with PCOS. I'm not sure about how hard it was for you to get diagnosed, but it takes the average woman 5 years and 3 doctors to get a diagnosis. And so our kit is testing for hormones and kind of screening for questions to help people get closer to a diagnosis. But the commonality between all of the kits, and we have some new ones forthcoming too, is insulin, because it really is the most important. And so we want to know how your body wakes up. That story you were telling about when you tested your fasting insulin. Fasting insulin, if it's high, you will start to feel all the things when you wake up. You will be shaky, you'll be hungry, you'll be tired, because your body is not supposed to have high insulin levels when it wakes up. It's supposed to have a meal the night before. You're supposed to go be rested throughout the night. You're supposed to wake up with a normal blood sugar and a low insulin, and you should be able to eat when you want and not have like all of these symptoms. And so testing for fasting insulin gives us the most accurate picture of where your insulin resistance is. And traditional screening labs will say normal insulin is anywhere between like 1 and 30. But really, if you're insulin sensitive, your fasting level will be below 8, and then even more ideally below 5. And what we do in our kits is we'll pair your fasting insulin with your fasting glucose, and we calculate something called a HOMA-IR score, which is a mathematical scientific modeling tool that doesn't just say, here's your insulin number, but it says, this is what your insulin resistance score is. And this is how insulin resistant you are. And you can have a normal blood sugar, technically normal, and you can have a normal hemoglobin A1C, but put the glucose, the blood sugar with the insulin together, and you can be severely insulin resistant. And I don't want people to be scared of that, because again, if you listen to this podcast, it's exciting to know about it, because then you can really transform the rest of your health, and you can reverse it. It's all very reversible. Everything we're looking for is reversible through diet and lifestyle. You just need to know about it. And the regular doctor's visit isn't looking for it. And so that's why it's the foundation of our kits. And we want people to be able to test frequently. We're actually, sometime next year, we're going to release a kit where really you can be testing your fasting insulin glucose monthly to see your progress and make sure you're on track, and use it more like you would a finger prick test, which is kind of more regular use. And it's exciting. Yeah, it's exciting to see your progress too. I love to check mine. I'm like, now I have instant access to it. I'm like, oh, what is it today? How did I respond yesterday?
That's awesome. That is so great. Like it is, I have been, ever since I, heard of a CGM, I was like, oh, we need one of these for insulin. But I feel like the technology is getting closer. I mean, this is huge to be able to test your insulin at home. I personally don't have a doctor. I haven't gotten labs done since maybe 2016. And I mean, it's been a long time. So maybe I should.
So you're sending in those results like ASAP.
Yeah, I'll send them in. So yeah, I haven't, maybe it was actually a little bit more recent than that, maybe like 2018, but I haven't ever gotten my fasting insulin checked, which I'd be really excited to see, because now I have no signs of insulin resistance anymore. But it is something that's pretty silent, and people don't really know. So if you come out, let's say you take this test and you come out as a person who has, quote, normal blood sugar, normal A1C, but you have these high insulin levels, what would treatment then look like? Would you still work on a blood sugar stabilizing diet? Because I feel like people would maybe question this.
Oh, that's such a good question. But the answer is 100% yes. That's the only way to come at it. There are two fundamental approaches in my mind when it comes to diet. And there are other lifestyle things that come into play. But with diet, it is timed eating. So not grazing all the time, right? We really like close our windows down. And whether that looks like extensive intermittent fasting or just not snacking, which can, it's hard for most people.
Oh, yeah.
And then understanding carbohydrates. And there will be some element of carbohydrate restriction. In my opinion, there should be for everybody, because we just eat way too many refined carbohydrates and processed carbohydrates in this country. You will always, to reverse the insulin resistance.
Oh no, it paused. Hang on 1 second. Oh no. Okay, are you there? Hang on, let me just switch my network.
Uh-oh.
Okay. Can you hear me?
Yeah. The only thing that I noticed was just like a second ago, it like paused, but I didn't hear anything. So I don't know where to go back to.
Okay. So you said the way to reverse insulin resistance, the way to treat the insulin resistance.
So the way to treat insulin resistance through nutrition, and there are a lot of lifestyle factors we can get into, but nutrition specifically is one. I recommend timed eating. So you have to kind of shut down this idea that we're natural grazers, because we're really not. And you need to give yourself a break, whether that's longer windows of fasting or just not snacking in between meals is a great place to start, because it allows your pancreas time to rest. Really, it's just like, let's let it rest. Let's let the insulin come down between meals. But then what should we be eating at the meals? You really do need to learn what a carbohydrate is, and we need to have some element of carbohydrate reduction. And if you're eating 500, total grams of carbohydrates a day, and you're going to reduce it to 250, you'll probably see an improvement. But if you are already lower carb, you might have to go even lower to really see an improvement in your insulin markers. And what's important for people to know, and I really think this is all very happy and motivating. But people think, okay, well, I'm just going to go keto for like 2 weeks, I'll fix it. And that's not really how it works. We really need to make this as a commitment to a long-term play here. This is a lifelong journey, because if you have the genetics and the life history that brought you to a place of insulin resistance, we just need to acknowledge it and honor it and realize that your body runs on a different sort of fuel optimally than you did in the past, and we need to correct it. And it might not always need to be as strict. So you might reduce carbohydrates lower, and then you can slowly add foods back in as you realize how your body responds to them, and as you become metabolically healed. But there needs to be an awareness that, okay, I need to shift some things. Like, this is not a New Year's crash diet. This is like, okay, I'm going to take the month of January and I'm going to learn what this is about. And then I'm going to set out to make the next year, a healthier year. And it's not just food either. It's a lot of, I know these are all the things you talk about, but it's lifestyle, right? It's like, we got to get up from our desk chair and we have to move, and we specifically have to move after meals so our body knows what to do with our blood sugar. And we need to focus on sleep and stress reduction. And all of those things, I say, will come in time, but don't try to tackle them all at once. the most effective ways to bring down insulin right off the bat are nutritionally. So I usually start talking there first, and then you can optimize, and then you can bring down all the other things.
I love it. I love it. And I love that the approaches, I feel like, again, it's this nice reassurance from a doctor who, we're speaking the same language here. And in my programs, we work on food. We talk about not snacking. That's like one of the first changes that we make, and starting to think about just making sure we're not eating around the clock. And at any point, if I do work with a lot of people with this reactive hypoglycemia or hypoglycemia where they're needing to eat before they go to bed and they're needing to eat very long. And in that case, they're just too sick to tolerate the treatment, which is to start reducing that. So we have to work through a food first approach with them, and then we work on the timing. But then that's hugely important. We work on digestion, so your body can actually break down these nutrients, because undigested fats are not helping to stabilize your blood sugar. If you're not breaking down the food, you won't absorb the nutrients. You won't have those B vitamins and the chromium and the zinc and all these important vitamins and minerals to actually work in the blood sugar regulation system, and the magnesium deficiencies that are so common that are contributing to insulin resistance and get depleted when we eat sugar. And then we really dive into the adrenals and the liver, which are two of the three major organs of blood sugar regulation, the pancreas being the other, right? And we have to support those organs. So we do a very internal approach using food and diet and supplements and these lifestyle factors, getting to bed. I mean, putting ourselves in bed earlier. Yes, blood sugar and insulin issues come with poor sleep, but what are you doing to prioritize your sleep? Do you have this light in your eyes, at 8 p.m. or 9 p.m.? Are we scrolling through our phones? So it's so many behavioral changes. And I talk to my clients, especially in my blood sugar mastery program. I always say, if you want to see big changes, you have to make big changes. So a lot of people we're so used to go to the doctor, get a pill, and you're going to be fine. Because when we're a kid, a lot of times that's what it was. It was like, oh, just get an antibiotic and then I'm going to be fine. So it kind of like ingrains this method in our head. And then we just don't have that same, we're like, oh, well, maybe I'll just take this supplement if I'm going to go, more natural, and I'll just take this supplement and maybe, I won't have all the fries at my meal. It's like, those are two very small changes. If we want to see bigger changes, we have to make those. And it does come down to these lifestyle things. And that's why being in a group and, the support that you probably offer to your patients is so important, because this isn't something that changes overnight. And it's not just like, oh, just switch out your milk for skim milk, like back in the day, it's not simple, and don't have skim milk.
No, it's not simple, but it's also freeing, and it sounds so amazing what you do. And it really, yes, there are big changes, but with it, imagine that you have so much freedom now that you're released from all these symptoms and you feel so much better. And that at the beginning, changes can feel very hard when it comes to nutrition, because again, it's just the opposite of how we've always been taught. And so you have to unwrap a lot of your beliefs about food. But as soon as you lean into it and start feeling well, I mean, it doesn't feel that hard anymore. So even though it might feel like a big, hard change at the beginning, it really isn't, because you kind of you're solving you feel better. You're solving for all the symptoms. And so, if anyone is kind of thinking about making the change with their eating and kind of digging deeper into their insulin resistance, do it. Because once you find it and once you figure out how, in your world, how to correct it and reverse it, there's literally no going back.
Totally. And so, the making big changes that I talk about are just sort of alluding to the fact that we need to make changes in a lot of different areas. We can't just, take a supplement and expect things to change. But the changes that we make, it takes a commitment. It takes like connecting with your why, like why you want to change. But then once you do make these smart changes where you're really targeting the root cause, you're not just like restricting your calories and then you feel hungry and then you're trying to work out so much and you don't have the energy and you're still so hungry and you're craving. That's hard because you're not doing the right, you're not addressing it from the right way. And so it feels like you're just white knuckling it, and it's all willpower. But when you do hit these root causes of the insulin resistance, so just stopping snacking. I mean, so many people tell me it was hard, but it also makes you prepare better meals. So now you're having to make this lifestyle change where you're like, oh, I can't just grab a granola bar on the way out of the house. I really need to make a full plate of food so that if I can't snack, that it can hold me over until my next meal. So now you've got some of these lifestyle changes, and a person already is going to feel so much better. And then taking out some of even just some of those refined carbohydrates and switching to real food, it's like they feel so much better. And someone with more energy is now going to be able to be super motivated to continue, and also have that energy to keep going with the lifestyle where they have to make their own food. And now I actually have energy to go work out and go take a walk. So it becomes this like self-perpetuating thing where they just feel so much better. And then you get addicted to feeling good, as opposed to like getting addicted to eating donuts and junk, because it's like, I just want to keep, oh my, I didn't know I could feel this good. Like, I didn't know I didn't have to. And then they're getting off medications, and it's just, their whole world changes. And so it comes from getting at the root of it. And that is why the Sowa kits are so powerful, because it's going to revolutionize healthcare. Like, I want to get in on this. Like, can I buy some stocks or something? Because I know it's going to be huge, because it's what's missing from it's really what's missing from the conversation. And I'm so glad that we have Ben Bickman's book, where he outlines it so well, where we can understand the connection between insulin and even things like tinnitus in your ear, like your ears ringing. That's from, like, it's crazy. It can cause so many things. One of my symptoms I used to have was tendinitis, and I know it was from inflammation, not necessarily insulin resistance, but I mean, I had chronic tendinitis in my ankles, and I was always going to a physical therapist, and I changed my diet. That was when I went paleo.
Amazing.
And I never had to go back. I mean, it's like the craziest symptoms in your body can start changing. So it's amazing.
When I have people log lifestyle things, it's not just food, I'll have them write down what they ate, how they felt about it, the circumstance around it. But then I also will say, put down all of your symptoms, like anything that's happening in your world, even before we get started. So I can see your headaches, your joint pain, your bloat, your diarrhea or your constipation, or your depression and anxiety. And I'll have them write it down. And then we'll do a review like 6 weeks later. And I'll say, are you still logging your symptoms? They'll say, yeah. And I'm like, oh, do you notice that there's some have gone away? Scroll back up, like, let's look. And I really recommend that, because people forget. And then I'll say, you need to store that in a part of your brain that keeps you motivated. I want you to write this down. You might not even have identified this as a goal when we started together, but now the fact that we took away headaches or we took away tendinitis, that's amazing. I love that, because yes, it's an inflammatory process that's upregulated by elevated insulin levels. And it's such a more powerful motivator. I just realized we hadn't really talked about weight or the scale, right, in this call, because in this podcast, because it's not my motivator, it's not your motivator. Generally, it's the number one motivator.
It was for me. It was for me when I had PCOS. Yeah, because I had weight loss resistance. I couldn't lose weight. I was gaining weight the same way that I had. And then I had this stressful experience, and it felt like it broke me. And then I was overeating paleo carbs and, dairy-free chocolate chips and acai bowls.
But now on the practitioner front, it's not the main thing we talk about, because it's not the most motivating thing. People will come, but the sustaining part of kind of managing insulin resistance and metabolic health is really how you feel overall. And yes, weight loss is generally a big benefit from it. But there's so many more things to be motivated by, because there's so many more symptoms that kind of overtake our daily life that are associated with excess insulin and, excess weight that comes from the excess insulin, and we reverse it. But it's like, people have to take note of it. And health is not just the absence of disease. It's also the absence of feeling miserable, right?
Yes.
So if you can feel good and healthy, it's the best motivator.
Yeah, for sure. And it's not like what I lead with when I talk about blood sugar and insulin, even though it is hugely impactful, because
Right.
weight loss isn't enough of a motivator for 99.9% of people to get them to change. And what I feel motivates people the most is just feeling better. It's hard to market that, let me tell you. But it's like, it's hard to market feeling better because it's so vague, but people just start feeling better. And so many people can't even describe, I can't put my finger on it, but I just feel better. And I'm like, well, are you sleeping better? And they're like, yeah, I am. I'm like, do you have more energy? They're like, I do definitely have more energy. I'm like, would you say you're like happier and more patient and less anxious? They're like, oh yeah. So it's like, those are all
Is your sex drive higher?
Yeah. Right. Yeah. And it's like all these little things that add up. I'm like, oh my goodness, I didn't realize I didn't feel like this, because we get so used to our version of normal. And we just think that, oh, I'm just not a person, like, I don't have the energy to work out because I work a full-time job. And it's like, that might be true, but you shouldn't feel like you need to head for the couch like a zombie after you return from a day of work. So, most of the time, there's always those exceptions, but we should have the energy to do things, to live our life. And one of the biggest things that I hear from clients who do start improving their insulin and blood sugar is that they say that they feel more like a participant in their life now. They're like, I can do things, I can plan things. And I know, right? It's just like, it's the best thing is that your quality of life improves so much when you feel better, when you have the energy to do things that fill you up, and you don't have these, like, I have to find a bathroom, I have to get the granola bar because my blood sugar is crashing, or I'm yelling at my spouse all the time because I'm so irritable because my blood sugar is imbalanced, or I'm not sleeping, I'm up all the time. I mean, these symptoms are legitimately interfering with people's lives. And they're, like you said, the good news, and I talk about this all the time, it's all reversible. So this is so exciting.
And it's the truth.
Yeah.
Yes. I mean, I agree with everything you're saying. Yes. Yeah. And it's thank you for spreading your message and for your platform, and because it's so hard. There's so much noise in this space, but this really is the truth, and this really is at the core of what, unfortunately, most of us will be dealing with, as we age in this country. And if we can get a handle on it now, you're just gonna live a much more fruitful, happy, healthy, unsymptomatic life. Like, what else can you ask for?
Totally. And do you know the current statistics on how many people are estimated to be somewhat insulin resistant?
Yeah. So at the very least, more than 50% of our country has insulin resistance, but those numbers are probably more on par with about 65 to 70%. So 70% of our country suffers from excess weight, and the tie between excess weight and insulin resistance is very, very high, and it's usually about 90%. So because science doesn't really look at insulin resistance, we have very skewed population numbers. We know that 30% of our population meets the criteria for prediabetes. But prediabetes is defined by blood sugar. And as we've spent the whole last hour talking about, you will have insulin resistance years and years before, and all the symptoms that go with it. At least 20%, at least 10%, more likely 20% of women have PCOS. And we know that cardiovascular complications and cardiovascular disease is in greater than 50% of the American population, right? And we know that tie, what we're starting to really realize is that what leads to cardiovascular disease, it's not high fats, it's potentially high fats, but in combination with high sugars. And it's really insulin resistance where we're seeing this. And so it's just an epidemic. The most crazy number I can pull out right now is that 88% of Americans suffer from metabolic dysfunction, and only 12% of American adults meet all 5 metabolic health criteria. They've got healthy cholesterol numbers, they have healthy waist circumference, they have healthy blood sugar, and they have healthy blood pressure. And it really shouldn't be that hard to have those healthy metrics, but it is, unfortunately. And we're treating them with pills and we're missing the diagnoses. Our kits actually do screen for metabolic health as a whole and looking for metabolic syndrome, because again, I think it's not a devastating diagnosis. I think it's an empowering one. Know that you have it and say, my doctor never talked to me about HDL being too low or my triglycerides being too high. What does this mean? Let's start here, because it's all reversible. And again, like, you find it and you can reverse it. You need to know you have it and to know to do anything about it. So it's dramatic. It's a big problem. So if you find that you have something that, you know, we've talked about today, don't feel alone. Really, you're one of many, the majority. But now, because you've listened to this podcast, you're actually one of the few who has the tools, because a lot of people don't know about them. That's why we have this epidemic. So,
yes, absolutely.
It's a good thing.
Yeah, for sure. And when you brought up the LDL and triglycerides, it reminded me that you do test for these cholesterol numbers in the kit. So can we talk a little bit more just quickly about the markers in the kit?
So in our kits, we test in every kit we have right now, we test for hemoglobin A1C, fasting insulin, fasting blood sugar, and those are our blood sugar ones. And then we do a lot of calculations beyond that. And then on the cholesterol front, we will look at LDL, which traditionally is the only cholesterol marker that gets any attention in medicine, but we actually care more about your HDL, which is your good cholesterol, and we want that number to be higher, and your triglycerides. So triglycerides are a cholesterol marker that's often totally ignored in the panel. And if it's high, your doctor will be like, oh, you must have eaten something without realizing it. So really what it means is that you have an excess of energy that's generally in the form of carbohydrates, and your liver is being overwhelmed in the packaging of it. And it is a surefire sign that you have insulin resistance. And so we really look for that. And then depending on the kit, we're testing for other things. In our PCOS kit, we're looking at female hormones to help women really get a better understanding of where their hormone health is and whether they have active PCOS or they kind of put things into remission, or if they don't even have it at all, because like I said, we're leading people to a diagnosis. Then we're testing for other elements like B12 and your thyroid, because that can come into play with metabolic health too, and inflammation markers like HSCRP. So it kind of just depends on what you're ordering.
Oh, I'm so excited.
we're rolling out new things. So we just want you to have a complete picture.
Love it. I'm so excited to start testing myself. Can you tell everyone where they can get these kits? And I will have a promo code for you with the kits, so you can get a little discount on them, because they are going to really answer so many questions for you. Because like you said, so many doctors refuse to give you a lab test, which is so crazy.
My husband's earbuds.
They came out.
I'm really sorry. My
That's
husband,
okay.
Can you hear me? My husband.
Yeah, I can hear you fine.
Call just like interrupted my earbuds. They just took over. I don't know what happened.
That's
He
okay.
started his work call. Oh my gosh.
It's okay. I can hear you.
So I don't know if this makes it to the podcast, but I don't even know where we ended, but I was like, I lost you, and now I hear his work call.
Oh, that's okay. So I was just saying, where can everyone find these kits?
Thank you. So you can find us at getsowell.com. And we actually have a new website relaunch happening this evening. So by the time this podcast, it will be brand new. We'll have a lot more education on our blogs, and it'll be easier to navigate. And you can find us on Instagram at getsowell too, or on my personal Instagram at Alexandra Sowa MD. And I'm always happy to answer questions and give us your feedback. We really want to hear what you want. And we're trying to expand more kits. We're thinking about doing a thyroid panel kit that's even in more depth, and some other testing options, because we want to make it easy for you to know your labs. And it shouldn't be so hard, and it shouldn't be so complicated, and you shouldn't have to beg, borrow, and steal to get some of these lab tests. So
Totally. So getsowell.com. My code is Danny10 to get 10% off. And I will definitely link to that in the show notes. And I'm really excited to be able to share this with my audience. I wanted to get you on the podcast as soon as I found out about it, because I'm like, people need to know about this. I've been waiting for this product. I told you when I met you, I've been literally just praying and hoping and waiting for something like this to come out. So I'm so glad that you can make it happen.
Oh, well, thank you. I mean, it's thrilling for us to be able to refer to people like you to help enact these lifestyle changes, because, we're helping people dig deep into their biology, but then it's the first step, and we want you to keep coming back and make sure you maintained it. And don't be like Danny, check your labs more often than every 4 years.
I'm going to now that I have access to this. So I'm really excited.
Awesome.
Yeah,
so thank you so much.
Yeah,
really
thanks so much for coming on. It was so great to have you. And I feel like we're so aligned with our missions, and it's so great that we have these different outlets to help people get to where they need to be. So it's a beautiful blending of two minds. So thanks so much for being here and sharing with us.
Thank you, Danny.